From Penn State Health, this is Ask Us Anything About HIV and AIDS. I'm Scott Gilbert. You know, HIV was once regarded as a death sentence. There still is no cure. However, people who get HIV today are living long, happy lives. That's one of the many things that's different about HIV from, say, 30 plus years ago when the disease was first entered into the public forum. Here today to talk about the current state of HIV and AIDS and to answer your questions about it is Dr. John Zurlo. He's an infectious disease physician and head of the HIV/AIDS program here at the Milton Hershey Medical Center. Good to have you with us today. Let's start by talking about the terms HIV and AIDS. I feel like a lot of people use those interchangeably. Can you kind of explain briefly what each means so we know that at the onset?
Yeah, sure. So HIV is the virus that, of course, was discovered in the 1980s that when it infects people, it can cause a kind of an immunodeficiency. The immunodeficiency is AIDS, that is to say, it's acquired immunodeficiency syndrome. So once the virus causes damage to the immune system such that it becomes so damaged that it can't protect in people who are infected from these unusual infections and cancers, then we call it AIDS.
I'm thinking back to the 1980s, names like Liberace, Rock Hudson, the very first celebrities who came out and admitted that they had HIV or AIDS. And what was the understanding of the disease back then? When scientists and physicians first started putting those puzzle pieces together, what did we know at the very beginning?
At the beginning, it seemed to, the virus, the syndrome of AIDS, seemed to attack certain individuals. So, for example, gay men, injection drug users, and at the time, way back when, it seemed like people from Haiti were also involved. And so at that time, we had some concern that there was an immunodeficiency that was something that was acquired. In other words, these people weren't born with it, but they somehow acquired it. And it soon became apparent in the early to mid-'80s that it was caused by a virus, something that spread from person to person. And that's when we discovered that HIV was actually the cause of this immunodeficiency syndrome.
Today, what do we know about who's most at risk? Have the demographics changed or shifted?
Well, I mentioned Haitians. We don't think about Haitians being uniquely involved anymore, but clearly it involves people who get it by sex, typically gay men, also women who are sexually active with somebody who's been HIV infected. And as we've seen now with the opiate epidemic, we're seeing more and more people who've become infected by injecting drugs. So those are the groups that are primarily involved.
In 2015, I believe I read about 2/3 of all diagnoses were gay and bisexual men, correct?
Yeah, that's probably correct, yeah.
And according to the U.S. Department of Health and Human Services, more than 1.1 million people today are living with HIV. Here's the shocking part, though. Many people don't realize it. How's that possible?
Well, you know, we talk about what's called the HIV Care Continuum now. We try to understand where people are on this spectrum of, okay, so you're infected, but you don't know about it. Happily, we've made some ground there. Roughly 90% of people who are infected, in fact, know about their infection. But then we have a steep drop-off into those who, let's say you've learned you're HIV positive, but have you connected with medical care? And we know that there's a large percentage, perhaps 40 or 50% of people who've been diagnosed, but they're not seeking medical care. Once you get into medical care, once you get on medication, then nothing but good things happen when people get on medication and the virus comes under control.
You're watching Ask Us Anything About HIV and AIDS from Penn State Health. I'm Scott Gilbert alongside Dr. John Zurlo, and we welcome your questions for him about this important topic, whether it's live on this Facebook video here on Wednesday, or Tuesday. Today's Tuesday, right? Or if you're watching it on playback, you can feel free to add your questions to the comment field below this Facebook post, and we'll make sure we get an answer for you from Dr. Zurlo. You know, HIV, as we mentioned at the top, was once regarded as a death sentence. Now it's viewed more so as a chronic illness. Can you talk about some of the medical advances that have caused this shift and made this possible?
Yeah, you know, through my career in the 80s and early 90s, we watched people get this virus, their immune systems became very weakened, and they died of all these complications. And we know that without treatment, we think at least 95% of people who are infected with HIV would otherwise eventually die of these horrible things. Beginning really in the mid-90s, we finally developed effective antiviral treatments to really fully control the virus. And those treatments really have sort of been modified and advanced to the point now there are many of these regimens of medicines that are combined into one pill. And really it turns out to be just one pill per day, usually extremely well tolerated. People tolerate them very well, which completely shuts off the virus and keeps it from causing damage to the immune system. And in fact, when we see that the virus is controlled like this, the immune system has a lot of ability to heal itself, and patients do extremely well. And so, in fact, when I talked with my patients, I don't say that they have a chronic disease. Disease would imply that there's something continuing to go wrong with them. But in reality, once they're on treatment, their virus is fully controlled, I say they have a chronic infection, but it's not really causing any damage, because we know that people with HIV who are on these medicines fully controlled can live a virtually normal, healthy life.
It's being contained. It's in them, but it's being contained and not holding them back.
Yeah, that's correct. Unfortunately, we haven't reached the step where we can actually cure it. That's one of the challenges. We know that when people are infected, though we can fully control it, there's still some virus that sits in these long-lived types of white blood cells in our body, and somehow the medicines aren't effective in eliminating all of those what we call viral reservoirs. So unfortunately, at least to our thinking now in 2017, when people stop medication, unfortunately the virus is still there and it can rev itself back up and continue to cause trouble.
But is the fact that this condition is treatable now through medication, has that had a negative effect in terms of the fear of the disease? I mean, you remember that the perception of AIDS and HIV in the 80s and even early 90s. Has that changed? Are people less fearsome of it and therefore perhaps less aware of avoiding the behaviors that can cause it?
Yeah, unfortunately, that's the downside of it. We've seen now, though the numbers of cases of people with HIV being diagnosed have come down. We see now, this is very promising over the last few years, but we also at the same time see that people who are not as afraid of it, who are engaging in behaviors, typically sexual behaviors with partners that they don't know who could be infected, often without condoms, and unfortunately becoming infected not just with HIV, but we're seeing an upsurge in certain kinds of sexually transmitted diseases. So we here and nationwide have seen just this huge upsurge of syphilis cases, and it's almost all in men. And so that's a challenge. Particularly our gay men engaging in lots of sexual activity with a lot of different partners are becoming infected still with HIV and all these other sexually transmitted diseases.
Are there misconceptions out there about how HIV spreads, people fearing that it spreads this way or that, when that's not really the case?
You know, I think that the public is generally pretty understanding of how HIV is spread. I do think there's a general understanding that it's mostly spread sexually. I think it's a matter of people just not understanding that indeed when they are sexually active with somebody, they don't know their status, their HIV status. They underestimate the possibility that that person could be infected and therefore infect them.
You're watching Ask Us Anything About HIV and AIDS from Penn State Health. This is Dr. John Zurlo. He's an infectious disease physician. He also heads the HIV/AIDS program here at the Milton Hershey Medical Center. Dr. Zurlo welcomes your questions in the comment field, whether you're watching this video live or on playback. What kind of role do healthy behaviors, I'm thinking of things like exercise, diet, and mental health, play in the overall health picture for somebody who has HIV or AIDS?
You know, we think it plays an enormous role. So we have somebody who's HIV positive. They come in, they get tested, they get on treatment, and they're under control. Well, all of that is great, but we know that for people who are HIV positive, even when it's fully controlled, it may add some additional risk, for example, for cardiovascular disease to develop, for example, strokes or heart attacks. And so, as it turns out, we understand both in our population that we care for here and nationally, a lot of the patients that we deal with, that we treat, they are smokers, for example. And we know that the combination of a slightly increased risk of heart disease because of HIV and smoking is a bad combination. So that's one of our many things that we try and focus on, getting people to stop smoking. Now that you're HIV positive doesn't mean you can't gain weight like lots of other people. So we deal with things like obesity, we deal with high cholesterol. So all of these things we try and bring together and create a comprehensive treatment plan for people. And then the final step is get them into a good exercise program. Stay fit. There's no reason that anybody with HIV positive, who was HIV positive, shouldn't and couldn't get involved in the same kinds of exercise programs that everybody else should be doing.
So it goes beyond just taking that one pill each day, a healthy lifestyle, which frankly we should all be doing, right?
A healthy lifestyle, and it's really part of both our plan, and I think anybody who's involved in HIV care now of their patients, they're going to want a comprehensive treatment plan, not just take your HIV medicine, but a whole comprehensive care plan to stay healthy.
If someone watching this video believes that they may have been exposed to HIV, what steps should they take? What should they do?
First and foremost, get tested. There's testing sites throughout Pennsylvania, throughout the Commonwealth. It's very easy to check with the Department of Health website or websites at Hershey Medical Center through our Optin site, and you can find places to get free, confidential HIV testing. The test is highly accurate. Again, free. Anybody can afford free. And that's the best thing to do, is to get tested.
Now, Dr. Zurlo just made a reference to optinforlife.org. That's optinforlife.org. That's an important website. Behind that is a very important collaboration. I'd like to talk with you a bit about that. It's a grant-funded collaboration that serves as a resource for people who are affected by and infected with HIV. Can you talk about the twofold goal of Optin for Life?
Yeah, Optin for Life is our own brand that we've created. It means opportunities for prevention and treatment. So opt-in, it's a positive message that we want people to find out about their HIV, get tested, get in care, and get under control. We know that behind the opt-in project is a couple of important facts. The opt-in project is aimed really at youth and young adults, because we know that on the one hand, youth and young adults who are infected are least likely to know that they're infected or to be in care and therefore not to be on treatment. We also know that the same population of youth and young adults are very tied to social media. They're tied to their phones, to their apps, to social media sites, Facebook, Twitter, and everything else. So with funding through HRSA, through the Ryan White program, which funds HIV care throughout the nation, we've received this funding, and it's a collaborative program that we've created with Penn State Hershey and Pinnacle Health, Alder Health Services in Harrisburg, and Hamilton Health. We're all part of this collaborative where we are focusing on our populations in the greater Harrisburg area of youth and young adults who are HIV positive. We want to bring them into care, and those that are in care, we want them to join our research program where they can download an app that we've created that will give them abilities to communicate with us, their care providers, to be able to look at their lab and results of testing, to know that they're under control. They can set reminders for their medications, all of these things. And we think it's so far it's been very successful in bringing youth and young adults into care in the greater Harrisburg area.
And it sounds like a big part of it must be to reach people who've engaged in some of these behaviors that could lead to HIV and may not realize that they may be carrying it.
Yeah, absolutely. And it is youth and young adults, of course, who are most sexually active of any age group, no surprise, and therefore they have a high risk of being infected and therefore also infecting other people.
And keeping these people engaged is so important, because I find it kind of surprising that as easy as it is to manage this illness, or this virus, I should say, to be more correct about it, there's so many people who, as you mentioned, just kind of fall out of their treatment regimen, and that can't have a good effect.
Yeah, I think one of the challenges is, I think for many, HIV is sort of, they know about it, but out of sight, they don't think about it very much. And I think one of the other challenges, if you think about medications for other kinds of illnesses, they take a medication and they feel better with it. Well, for many of our patients who've never been sick because of HIV, whether they take their medicine or not, whether they go to their visits or not, they feel the same. Remember, HIV, the disease really plays out over months and years. So day to day, they don't feel different whether they take or don't take their medication. But the key is making them understand that in order to really have full control of this virus and stay healthy and never get sick from it, they have to take this medication. 1 pill every day. As I say to my patients every day, it'll take about 15 seconds to take that pill, swallow it down. The rest of the day is yours. But every day, you got to take that medication to stay healthy.
The website is optinforlife.org. And tell me about some of the examples of community outreach that are happening. It sounds like, as you mentioned, because of the audience being young adults, teens, a lot of that is through social media and through electronic means. But what are some of those efforts that this involves to bring those people together for this important dialogue?
Well, once again, the major focus is social media, but we're out there. We're out in the streets. That's what we've hired and collaborated with the Alder Health Services in Harrisburg. It's a clinic and program that serves, among others, the LGBT community in the greater Harrisburg area. We have Hamilton Health, who is very involved in the infected and highly affected communities within central Harrisburg. They're out. We have outreach workers who are sort of traveling around the schools and the venues where they might meet people to try and, in a sense, sell the brand being Optin. And once they get sold into the brand, maybe they'll get tested, maybe they'll get into care, and maybe they'll therefore come under control and do well.
It's a great mission. Good luck with it, and thanks a lot for your time today. Appreciate it.
All right. Thank you very much for having me.
All right, Dr. John Zurlo, he's an infectious disease physician, also head of the HIV/AIDS program here at Penn State Health, Milton S. Hershey Medical Center. One last time, that website to check out is optinforlife.org. That's optinforlife, all one word, .org. And we'll put a link to it as well in the comments below this Facebook post. Whether you're watching this live or on playback, we welcome your questions for Dr. Zurlo, and we'll track down some answers for you about HIV and AIDS. Thanks so much for watching. Ask us anything about HIV and AIDS from Penn State Health.